Why do we give fluids that contain potassium to someone who's in DKA? We actually give fluids two ways to someone who's in DKA. We give our bolus fluids, a resuscitation fluid, in order to restore volume, and then we provide ongoing maintenance over the course of several hours while we resolve the DKA. Most of our DKA patients are hyperkalemic, so why would we give a fluid that contains potassium? Well, this might blow your mind, but not only do we give a fluid in our boluses that contains potassium, but we actually add potassium to our ongoing maintenance. So what gives? The thing is that these DKA patients are perpetrating a fraud because they're not really hyperkalemic. They're just make-believe hyperkalemic. Their big problem is that they're in a state of metabolic acidosis. And when you're in a state of metabolic acidosis and your pH drops, your hydrogen gets really angry and hydrogen starts barging its way into your body cells to hang out until the worst is over. But in order to make room, they push out potassium. And so you become relatively hyperkalemic. So you'll see some pretty high serum potassium levels in these patients, like 7 and above sometimes. But as we resolve that metabolic acidosis by giving the body actual glucose to use as energy, that hydrogen will start to feel safe again and will come out of those cells and potassium will start going back in. Now, you would think that all that potassium going back into the cells would just normalize a DKA patient's potassium levels, right? But that's not the case. Once we resolve that acidosis and all that potassium goes back into the body's cells, we have to remember that before they got to the hospital, they were peeing and peeing and peeing and peeing to get rid of all that extra glucose. And what do you lose when you pee that much? You lose electrolytes. These patients were losing a lot of potassium. So their potassium levels don't actually normalize when this happens. They actually become hypokalemic, sometimes critically so. So once their potassium drops below 5.5, remember normal levels of potassium are between 3.5 and 5.5 milliequivalents per liter, we start adding potassium into their maintenance fluids in order to keep it in that normal range. But that doesn't answer the question about lactated ringers. We don't really concern ourselves with the actual amount of potassium that's within a person's body. We concern ourselves with that person's potassium concentration. And when we administer lactated ringers, we are administering a concentration of 4 milliequivalents per liter, and the normal potassium level in the body is between 3.5 and 5.5 milliequivalents per liter. So if you have a patient like a DKA patient whose potassium could be over 5.5, let's say 7, and you administer lactated ringers, which has a potassium concentration of 4, you're actually going to bring that patient's potassium level closer to 4. And that is why we are actually unconcerned with the potassium levels in lactated ringers and why we actually add potassium to their ongoing maintenance.